Welcome to another video. In this video, we will continue learning medications for the cardiovascular system, antihypertensive classes starting with the centrally acting alpha 2 agonists. The action of this medication stimulate alpha adrenergic receptors in the brain to reduce peripheral vascular resistance, heart rate, and systolic and diastolic blood pressure. The most common medications of the cardiovascular system are these three: clonidine, guanfacine HCl, methyldopa. The main reasons for using these three medications are for primary hypertension, which may be used in combination with diuretics or other antihypertensives. Another important use of this medication is also for a hypertensive crisis and severe cancer pain. With these medications, there are a number of important precautions to take, which are the following. Contraindicated with anticoagulant therapy, hepatic failure can result. Do not administer to clients taking MAOIs. Do not administer methyldopa through IV line with barbiturates or sulfonamides. Use cautiously in CVA, MI, diabetes mellitus, major depression, or chronic renal failure patients. Do not use during lactation. Side and adverse effects are the following: dry mouth, drowsiness and sedation, which will resolve over time, rebound hypertension, black or sore tongue, leukopenia. Now, with the nursing interventions, these are the following most important actions. Monitor for adverse CNS effects. Monitor CBC, heart rate, and blood pressure. Assess for weight gain or edema. Monitor closely for rebound hypertension when medication is discontinued, especially over the next 48 hours. Client education includes teaching the patient the following: instruct to never skip a dose. Teach to take at bedtime to minimize effects of hypotension. Educate the patient to notify prescriber of any involuntary jerky movements, prolonged dizziness, rash, yellowing of skin. Well, that's it for this video. In the next video, we will continue the lesson by learning about beta adrenergic blockers. See you soon and thank you.